The beginning is a very delicate time. Welcome to the IMAET Nation. It is our passion and purpose finding answers to our most challenging health concerns. My journey as a scientist and energy healer have led me here, to the place where science and spirituality converge. This is where the answers are that unlock the full potential of the physiology. We do not accept dead-end diagnoses. We do not tolerate limitations. It is our birthright to live healthy, vibrant lives, and we are taking that back. Thank you for being here with me. Hey there, welcome back to your IMAET Nation video training series, number 3. So by this point, you know how to get in and close the curtains and open the voltage channels and get ready for a treatment session. So this video is going to go over some of the different treatment options you have once you get to this point. But before we do that, I want to go over a few pieces of information. And if you have your cheat sheet in front of you, you can go over this. You can follow along with me. So important point number 1. It's best to keep this computer in airplane mode. It seems to work better not connected to the Wi-Fi. Of course, you can turn it on and access the Wi-Fi, access email. To make this video, I have to be on Wi-Fi. But in general, when running treatment sessions, the software seems to work better or a little bit more effective when it's not in reception mode. So that's the first point. Second point, it's important to know that there is like a maximum amount of time that you should work on someone or yourself. Clearly, we've experimented with this a lot and everybody's body is a little bit different, but the body only has so much ATP to spend on a healing session. So we don't want to be in here for hours and hours. It seems like 45 minutes is kind of max time. So just be mindful of that and the way you go about these treatments. We'll be going over a lot of that today and the rest of it in the next training video. Okay, important point number 3. It's important to exit fully out of the program every time in between when you're going to work on yourself. If you're going to work on yourself again the next time or someone else, you're going to want to get fully out of the program. And by that, I mean the IMAET window itself, you would close it and only see the main screen for the Microsoft computer. So fully exit each time in between sessions. Important point number 4. When you start working on other people, it's important to know that we don't do this kind of work without someone's permission. It's important to have someone's permission to be going in and working energetically on them. Now, of course, there are a few exceptions in my opinion. Of course, this is just my opinion, but a mother or a father working on their children, there can be exceptions to that. Just like mothers and fathers make lots of decisions and intercede on behalf of what their children need. There are some exceptions in that way. Obviously, our pets, which we will get into in another training video as well. We can work on our pets. I feel like they have already given us permission to do so. Okay, important point number 6. Be attentive. Be attentive to the panels that you're running. We don't want to get in and leave things running on people for extensive amounts of time. I definitely have made that mistake in the past. We want to be aware and be paying attention to what's going on with these panels. So it's not something to do kind of on the side. And important point number 7, no fear. We never bring fear into the IMAET. Lots of different markers will come up. You'll see strange things. We see it all the time. There's these items in a certain panel I call odd items. And they can seem concerning, but there's always a reason, and there's never any reason to fear. It's important to understand that things present energetically way before they present physically. So that's the last important point to note. Okay, let's go into the different types of treatments. There are a few different categories. The first I would call plug and play. So these are going to be treatment sessions that you come in, you close the curtains, you address the spine and the energy meridians, you've got the voltage channels open, and you're going to come in and now just go and treat something. These plug and play treatment panels are mostly right over here on the left side under systems. So we'll go through a few of them, but then knowing that each of these work pretty much the same way. So let's go to that digestive panel. So in here, we can see that we have a couple different things going on. We've got a narrative here that will always be describing whatever's highlighted in blue. Lots of great information down there. We have two options. We have functional stress, we have anatomical. So right now you can see it's on anatomical. These are all the anatomical components of the digestive system. But if we toggle to functional stress, we see all kinds of conditions and itises and situations related to the digestive system. So we can pick between the two. And you see that we just come in here and we're going to be fixing things. We're not really going to be doing any diagnostic work in here. Now over here on the right-hand side, we can see we've got these two boxes. Up here, we have the option to add these additional focus items, which we mostly always want to do. It is left open in case there's a reason you don't want to address one of these four categories, but mostly we want to address whatever the thing is we're working on in these four emphasis areas as well. Now up here, these four items are contained also on the functional stress list. Dr. Straley has created that as kind of a quick reference. These are the top four most commonly worked on items. So he puts them right here. So if this happens to be one of the ones you're working on, you come in, you don't even have to find it on the list. You can just select it right here. So these items are also contained over here. And down here we have the biofeedback, which we've already seen this box in the brain panel and the other panels. This is how we actually apply the feedback. So when we're here, we come in, we're picking an item. Let's pick heartburn. I'm going to make sure it's highlighted in blue. I'm going to come over to the set time, set it to 0. Again, make sure it's in blue and hit feedback. And now we see the blue bar going across, and with each pass, the percent harmonized will be updated. And so we wait for this to get close to 100. Now, a point to make here about the max time being 45 minutes-ish. We don't have to wait until it gets all the way to 100. 98, 97, 99, that's pretty dang close. And considering that we don't want to spend all of our ATP with that one last point of this one panel when we want to go spend it elsewhere as well. So once it's close to 100, let's pretend that it is, you stop it. And if there are other things to address here anatomically, let's say liver, we can do the same thing, apply feedback. We're waiting for this to get to close to 100% harmonized before we move on. Okay, so let's pretend that we're there. We're stopping the feedback. Now we're going back to the navigation panel. So I'll go over a couple more here, but the rest of the items on this list work almost identically. So if we see in the muscle panel, we see the page looks pretty similar. We've got the description here, the narrative. We've got functional stress and anatomical. We've got the focus add-ons here. We've got the top four commonly worked on items that are also on the functional stress list. So we come in, we are finding what we want to work on. Also, it's good to note this panel info page has all kinds of pertinent, useful information. I can see that my screen's cutting part of that off. Sorry about that. But this is always being updated as well. So if you want information about how the panel works, you can open this page as well. Okay, so back in the muscular system, we are in here to work on, let's say, bursitis. We're selecting it, setting the time to 0, and you can see that that happens when I set the time to 0 here. It sometimes takes the highlight off of the item. So if that happens and you apply feedback, you sometimes will get an error code here that says TM not enabled. If that happens, stop the feedback, make sure it's highlighted in blue, and then you can see that I did forget these 4 items here. Feedback. Okay, so again, we're waiting for this to get to close to 100% harmonized, and we can work on as much as we want to in here. You can stay mostly in a few panels. You can pick items from each panel that you know need to be worked on. But once we are satisfied with the percent harmonized, we stop, we go back to navigation. Okay, without going into that much detail, now I'll just show you the other panels that work exactly the same way. Eyes and ears. It's really important to come in and familiarize yourself with what is here to be worked on. That way when you need to work on something, you will know where to look. So scrolling down here, we can see dry eye infections, eye allergies, glaucoma, macular degeneration, all kinds of stuff. Spots and floaters, tinnitus, and again, we also have the anatomical option here as well. The lymphatic panel works the same way. You can see the page looks the same. We've got the two options here. What you'll find in here: spleen, lymphedema, sarcoidosis, tonsillitis, nervous system. This panel works the same way. Here are some of the things that you can find in this panel. We've got ALS, epilepsy, Huntington's, nervousness, nitric oxide toxicity, schizophrenia, TMG neuralgia, and prions are even here. Respiratory. Seems like this is a commonly used panel this time of year. We've got bronchitis, pneumonia, COPD, hay fever, RSV, snoring. That can be useful. Sinuses. Here's some of the items here: rhinitis, cough, dry mouth, GERD, hyperthyroidism, laryngitis, even nosebleeds. And of course, sinus congestion, sinus headache, sinusitis. That's why this is so amazing, because it can address the specific causes of sinus dysfunction. Now, I know that we've already been to the spinal panel. We know that because it's necessary to open the voltage channels. Here's another panel that also involves the spine, but in a very extensive and specific way. So in this panel, you can find under the anatomical category every single bone, every spot on every bone. This is a very extensive panel. So if there's known bone dysfunction, you will find it on this page for sure. And then of course, under functional stress, we've got things like herniated disc, bone spurs, osteoarthritis, osteoporosis, spinal stenosis. So again, it's a more extensive bone panel. Okay, now the other panels in this category, which are plug and play, we have sarcodes, we have dermatomes, and athletic. They just look a little different. The pages are organized a little bit differently. The athletic panel is a newly opened up panel, so it's still being developed. And so we don't have an anatomical versus biospecific toggle button here, but we can see lots of very useful things on this list as far as hormone components of athletic performance. Now on this page, the thing that's different is up here. Down here, the focus add-ons are the same, or the option for the focus add-ons are right here. These 4 items up here are not contained on this list. This is where the panel is still being built. If you click on one of these, it's going to open up this other panel that is being built. So once you click over here, you'll see we lose the other list. So when you come and work in here, make sure to work in the list that's up first when you get here, and then when you click on these 4, it'll take you to another list, and you can work on these items as well. Okay, dermatomes. This also works a little bit differently. So when we come here, we can see the areas on the surface of the body, the skin, the tissue, that are that would be affected by a spinal compression spot. So the nerves and the circulation that come through every spinal connection, they feed different parts of the surface of the body. Those are called dermatomes. It's like a map. So if there's a compression spot, the part of the surface of the body that is fed by the nerves and circulation coming through that spot are going to struggle. So this is a plug and play panel, but we need information from the spine panel. So if you're in here, you would have already gone to the spine panel to open your voltage channels. So at this point, you would come in here and then we would link back to the spine to reference it. Now, I haven't done a bioscan on this pretend person, but we're pretending that we would have done that at this point. So when you come here, I'll perform this now just so we have some numbers to work off of. You're going to reference the numbers that you've already bioscanned and you've already performed feedback on those items. The numbers here reflected on each spine connection spot, those numbers will not change even when they're harmonized over here. This is the number that's going to be changing. We want this to get to 100. But these numbers will not be changing. They will still reflect the same numbers that came up when you performed the bioscan. The only way to get a new set of numbers is to exit fully out of the program, come back in and do a new visit. But since we're in the same visit, these numbers will still be here even though we have already harmonized them. So we're referencing these numbers over here. We're looking for single digits and really high numbers. I can see there's nothing over a 73. Keep in mind also with these panels, the color indicators are just what is lowest, what is highest, and the two in the middle. These aren't necessarily items that need to be worked on. We work on single digits and items 90 and over. So we can see that the highest number here is 73 because it has to give something the highest. But that doesn't really need to be worked on. So that's not a number I'm going to reference and take over back to the dermatomes. So when I'm here, I'm eyeballing spots that do need to be worked on in the dermatomes. So I can see cervical 2. If I go link to dermatomes and go back to that page, so I've done nothing in the spine panel but reference. I come back over here and I can select cervical 2, set the time to 0, and I can apply feedback. So it would have been smart of me to write down all of the points that are of concern so I don't have to go back and forth each time. But if I had done that, once this harmonizes to 0, I would stop the feedback, I would select the next point that was a single digit and do the same thing. Okay. So the only other plug and play panel over here that we haven't been to yet is SAR codes. This is a great panel, especially in the beginning when you're learning to use the IMAET, because it is a plug and play. The panel just looks a little bit different. So it's going to have these 4 categories: brain, systems, organs, glands. And again, we want to apply all 4 additional feedback almost all of the time. And we're coming in and we're just picking what we know needs to be worked on. We know sinuses. So yes, we can work in the sinus panel, absolutely. But this is a really nice plug and play overview treatment type place. So we are selecting sinuses, we're setting the time to 0, we're hitting feedback. Again, we're looking to get as close to 100 as we can without wasting too much time. This is a nice panel when you're not really sure where to go or what to work on, but you know of particular symptoms that have been present for a while. Some people really feel a benefit from this panel. Okay, back to the navigation page. So we've covered the plug and play panels. So what we're going to do next is we're going to talk about the partial diagnostic treatment panels, and there are several. So technically, we know already of some of the partial diagnostic panels, right? The brain panel is partial diagnostic. And again, this is a pretend person, so don't be alarmed that I haven't done any of this in here yet. So this is a partial diagnostic and treatment panel, right? Because we are performing a bioscan. We're getting information and we're also treating. Also the meridians panel, this is a partial diagnostic panel. We can perform a bioscan and do treatments. Same thing with the spine panel. But besides those, what other partial diagnostic and treatment panels do we have access to? This is the heart panel. So it looks similar to the plug and play only panels, but we do have the ability to do a test potential here. So this button here will do a test potential of these different components of the heart, and it will rank them in order of concern. We also have over here what looks familiar to us already is we have these toggle buttons of functional stress and anatomical. So under functional stress, things to work on here: hypertension, mitral valve, vascular disease, varicose veins, vasculitis. And again, we are almost always adding the 4 focus items. Hormones. So we have partial diagnostic and partial treatment. We see that we can just come in here and treat. If we know we want to work on serotonin and there is an issue, we can select it here, set the time to 0, and feedback. But we can also perform a bioscan here. And just be mindful, there is a male and female side. Make sure you're performing the right one. You can perform a bioscan here and find the top 3 items of concern. So this is a pretend patient, but if I perform the bioscan, it's going to rank 3 things. So I'm going to take it through this just so I can show you how to treat. We also have these options as well for ovarian stim and prostate stim. It's a 3-minute treatment program. It's really helpful for PMS type symptoms. Okay, so once we perform the bioscan, it's going to rank 3 items of concern. 1, 2, 3. Now, if we don't select anything individually, if we leave it once we select bioscan, and this is similar to the other panels where you can do a bioscan and it will rank them 1, 2, 3 like this. You can come over here, set the time to 0, and if I hit feedback now, what's going to happen is it's going to cycle through those top 3 items. It's going to move from insulin, it's going to move to thyroxine, and it's going to move down to serotonin. It does this after spending about 15-20 seconds on each one. Some of the panels it lasts a little longer, but it's going to cycle through all 3 of those. You can see now it just toggled down to thyroxine. It's going to keep cycling through these, and you'll see the number over here change as it moves to each one. So right now it's at 39%. And now as it moves to serotonin, it's 20%, and then it'll move back up to insulin. So you can just let this run until you see that all of them are almost at 100. And again, they don't have to be all the way there. And it's okay that one of them may hit 100 right away, and the other ones will take a second. It's all right to keep letting it pass over those, because this is harmonizing. You can't over-harmonize something. This isn't elevating or reducing. It's balancing and harmonizing. So once you do the bioscan, if you select 0, it will cycle through all 3. But if you do want to just work on one of them, you can just select it. And now when I hit feedback, it will only be working on serotonin. It will not be cycling through all 3. So it gives you the options for both here. Okay. Next panel. Dental panel. Again, these are partial diagnostic panels. I love this panel. A lot of things to test here. So this is just a treatment. If there's known TMJ, this is really beneficial to run this 5-minute auto TMJ feedback. You can also do a bioscan of dental materials or dental disorders. So if you click on dental disorders, Well, it's not letting me click on that for some reason. Should be able to, unless I accidentally clicked on that. Aha, there we go. Okay, so you have these two choices for bioscans. So you can pick which one you want to do the bioscan of, and you can do them both and see what's coming up. TMJ may come up here, oral abscess may come up here, and you can look for actual dental materials as well, as far as things that were used in root canals or fillings that may be causing a problem. Over here also you can do a bioscan of the actual teeth, and it will tell you which ones are either inflamed or there's infection, but it will rank them, like in the other panels, the top 3 of concern. We have the focus here as well, and we want to almost always add these, whether we're treating something here or something that came up in either of these 2 bioscans. We'll want to make sure to add the focus. Again, set the time to 0 and feedback. And since this is a partial panel, we don't have to do bioscans here. If we know that gum disease is an issue, we can just come right to it and select it. Add the focus and feedback. This is a fun one. Neuro-emotional profile. So with this one, it's good to reference the spine panel. We don't have to, but what this is going to show is neuro-emotional profile of emotions that are stuck in the spine, because that can happen. Issues are in the tissues, right? So over here, when we can see there's compression, emotions can get stuck here in these spots in the spine. That's how this works. Different emotions reside in different places in the body. Like anger likes to be in the liver. That's kind of where the body houses anger. Other emotions are housed in other systems and organs. So we come back and we reference this, and we look at the spots that are compressed. This page doesn't have a direct link to NEP, so we have to go find it again. But when we're here, you can do a bioscan, and it will highlight which of these emotions are stuck in those spinal compression spots. It's really, really useful. Another amazingly fun part of this panel is you can click this button, a subconscious self-evaluation hint, and it is uncanny how accurate this is. So if you're doing some emotional work, you're trying to uncover what subconscious programs you might have going on, or you're just feeling emotionally raw and you can tell that it is affecting your body, but you don't know where to start, come in here and click this button, subconscious self-evaluation hint, and I guarantee you it will be insightful. Okay. Emotional panel. This is one of my favorites. I call it the magic panel. Man, there's a lot to do in here, a lot. And again, this is partial plug and play. This is partial diagnostic. A lot going on this page. Over here on the left, we can see we've got check a feedback choice. We have all these different options. So over here, this is just plug and play. This is just come in and treat. So we have behavior processes here, attitude change, use that on myself a lot, body-centered, we've got fatigue reduce, revitalize stim, brain processes, super beneficial, clear energy field. A lot of us don't realize how much we sponge up other people's stuff, and just by clearing our energy, we can feel a lot better. We've got circadian stabilize, enkephalin stim, this is going to help the nervous system, high-low brain sync. We've got exploration processes, really fun stuff in here. Introspection, receptivity, focusing, attention, concentration, intelligence, learning, logic, inner self processes. This is a fun page here. Astral projection, ESP, past life rejection, regression, maybe it is rejection. Relaxation processes, this is one of the most commonly used pages. Anxiety reduce, profound relaxation, stress reduction, tranquility, well-being, and solution processes. Positive thought. So you would come in here, positive thought, find the item you want. Over here on the right, set the time to 0, and feedback. Okay, so that's the first part of this page. Now, it's important to note that this box up here is not like the other boxes. This is not a feedback, additional feedback. This is a whole box in and of itself that is related to these 4 right here. So don't think that you need to have any of these selected. And you'll notice that when I came in, one of these is already selected in each. It's just going to give me the ability to do a bioscan here, but it's not automatically doing anything. So nothing is selected when you come in here in the first place. So the next thing on this page is these 4 boxes. Emotional stress factors, conflict stress factors, age stress timeline, relationship stress factors. This is such a beneficial page. And so we have 2 options with these boxes. We can select the one we want, conflict stress. Let's say I want to see the top 3 reactions. Do the bioscan. And it's going to go down through these conflict stress factors. And it's going to rank them, the top 3 that are triggering the body. And sometimes these will seem very odd. And it's important to keep in mind, sometimes this isn't your stuff. Sometimes you're picking this up from someone else. Or maybe there is some deep dive work to be done where this stress factor is being retained by your body, not by the conscious mind. That happens a lot. Trauma can reside in the body. Relaxation conflict, aging conflict, legal conflict. So again, it's ranked all 3 already. If we hit the feedback button, it's going to cycle through all 3, just like the other panels. But if we want, we can select one of them and hit feedback. Now, besides doing the bioscan, we can also just come in and select. Let's say we've got someone that or it's us, and we just know that they need some unconditional love. We just come in and find it, since it's still alphabetical. Once you do the bioscan, it will not be alphabetical, it'll be harder to find. This person needs unconditional love, selecting it. Feedback. And I'm just going to let this run, even maybe a little past 100%. Can definitely pick up someone's mood or help them feel balanced or accepted or unconditionally loved. In this panel, this is a tremendous place to work. Okay, trivector. This panel is mostly diagnostic. So we are going to save this panel for the next training video. I just wanted to at least come here to show you there are things we can just treat, but there is a very large diagnostic panel that we are going to go over in the next video, which is, the next video is about these more diagnostic panels. The body biofield is one of those more diagnostic panels. So, first time coming through this software, it is vast and it can be overwhelming. But I want to just at least bring you here and show you this is a place for diagnostic work. The allergens panel also is a diagnostic panel that we're saving for the next video. Over here, these items over here are a mix between both diagnostic and plug and play. Nutrients, great panel. So this is a diagnostic panel for these 3 categories: vitamins, amino acids, and minerals. You can perform a bioscan here, and this will rank these items very much like the meridian panel and the spine panel. So things that are single digits here, or things that are 90s and above, need to be fixed. So you can select them, come over here, set the time to 0, and apply feedback. So you have these 3 options as far as bioscans. Now this page also has something very, very cool. There's a difference between asking the body as a whole. When you're doing the bioscan, it's a systemic look. what's low, what's high systemically. But what's happening systemically as a number it can give may be different for if you're asking just about the liver. So magnesium deficiency systemically may be not concerning, but to the liver, yes, the magnesium levels in the body are very concerning. So what you can do is you can type in here whatever organ you like, liver. You can type in the nutrient slot magnesium, and if you click test energetic imbalance, you'll get a number here that explains what percentage of what's going on in the liver is related to the magnesium number that has already come up. So you can put in whatever organ you like and find out, for example, if biotin is, let's say biotin is a 30. That's not super low systemically, but if you put liver in here and biotin, and this comes up 98%, that means that the biotin levels are very concerning for the liver. And so we would want to set the time to 0 and apply feedback. Detox panel. So this is partial diagnostic, partial treatment. You can perform a bioscan here. All these items, some of which may seem very odd. And it's taken quite some time for me to track down what all these items are. For example, if cosmetics come up for someone who does not wear makeup, that's interesting. Well, that's because there are chemicals, some of these forever chemicals have been in cosmetics for decades. And when they get in, sometimes they don't come out, and we need to take some good binders. We need to find out, which ones we have, and we can treat them with frequency, but, don't let anything throw you as far as, well, this is a man we're working on who's never worn cosmetics. Some of the chemicals that were in cosmetics, especially decades ago, are common to lots of other areas of exposure. So it's pointing it out here for a reason, and it's good to pay attention to it. Again, you can do the bioscan, and then things that are coming up high. Again, it's important to note that when we're looking at an item and we're wondering whether we should work on it or not, it depends whether it belongs in the body or not. If it belongs in the body, like liver or magnesium, we want it to be a 50. But these things, we don't want these really in our body. So things that are low and single digits, we'll leave those alone. We only work on the high numbers, 90s and above, when it's something that doesn't belong in us. Because if the body's barely aware of something, it'll be a single digit. So if the body's barely aware of the liver, that's a problem. But if the body's barely aware of insecticides, that's fine. The body's saying we don't even know what that is really. So wonderful. So we have these 3 options here. Can be very enlightening. And again, there's always a reason. Alcohol coming up high, maybe in a child or someone who does not drink, that can indicate auto-brewery syndrome. So there is a reason for these things, and we can treat them here and use them as clues to go into the deeper diagnostic panels. Frequency specific. This is another panel with tremendously useful things to come in and treat. So this is not a diagnostic panel, this is a plug-and-play panel, and there are so many things on this page. And we only have the functional stress here. We don't have an anatomical choice here. This is a long list, but you can find everything here from acute pain, allergies, appetite, arthritis, bacterial infections, bed sores, blood pressure. I mean, this list is long, and there are a lot of really useful things here. And I love this panel because it has additional feedback options. So let's find something. Let's say someone's having chickenpox. We're going to apply these focus items here, and look what else we can address. If someone's having whatever issue we have clicked on here, and it has anything to do with metastasis or medications or radiation, or this person has received chemotherapy and now experiencing some of these symptoms here. Set the time to 0, hit feedback. and all 8 items are going to be addressed. So in this panel, these usually take a little longer to rectify here, to harmonize to 100%, because we're addressing it in a very diverse range of categories. Now, there are other things in this panel that we're going to go into at a later time. There's a manual signal generator down here. This is like a built-in Rife machine. So if you have a Rife machine, or you know those frequencies, you can put those start and finish frequencies right in here and apply it as an additional feedback to any of these items. So if you know the Rife frequency for love or general balance or chicken pox, you can apply that frequency here as well, and it's like double frequency treatment. Okay, we also have the chakra aura panel. This is fun. So we've got several bioscan availability in this panel. We can bioscan the chakras themselves, and it will rank them with numbers here. So you can see if your spleen is a 2, you know that this chakra is underactive. If your crown chakra is a 99, you know it's overactive, and you can balance them here. You can also do a bioscan of your aura. When you click this button, after it's done doing the scan, it will show you what color your aura is. And also here, you can do a bioscan of the color profile, which will show you what color you need right now to balance your aura. This is really fun. Geopathic stress. This is great. This is one of the new panels as well. We're finding that these fluctuations in the electromagnetic frequency of the planet, they're called Schumann resonance spikes, are really affecting people, especially if they have heavy metals. People can live on fault lines. This is good to do, especially when someone is held back with their health and can't seem to figure out why. There could be some geopathic stress going on at your home. So what this is testing when you do the bioscan is the geopathic stress of your home. No matter where you are, you can be traveling. In the navigation client profile, you're putting in what this person's home address is. That's why it's important to know where does this person call home. So when someone's traveling, we don't update the address because that's not their home. The truth of that person is that my home is, blah, 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 blah street. So when we do the bioscan here, this is going to assess the geopathic stress of their home, and you can identify whether there are these issues at the house. Really important information, especially when someone's held back. This panel will also be covered in another training video in an extensive training, because I'm very passionate about working on pets. So this, for now, this is a great panel. It's very user-friendly. It's obvious what you'll be doing in here. Good to point out, though, that you will have to have your pet in as a client already. And on that note, when you're inputting your pet, let's say you're going to put your dog in, if you know when they were born, great. Time, great. If you don't, whatever information you have, animals are so receptive. What you don't want to do is put any information that is not theirs. Don't put a phone number, don't put an email, just put the information that you do have. Physical address, obviously you'll have that. And then you can come in and you'll want to make sure to select what animal we're working on and the focus, and then we can find the thing that needs to be worked on. Bone fracture. Setting the time to 0, applying feedback. Again, this panel is diverse, and you can also work on your pets in the regular panels as well. But we'll be going over that in a different video. Okay, so at this point, we've covered all the panels that are available. And what the next video will be covering is how to go in and do a deep dive diagnostic, find the root causes, create treatment baskets, which will be done in the allergen panel. And that type of treatment that we're going to go over in the next video is only done a couple times a week. So first off the bat, what you have the knowledge of right now is to come in and use these panels, these plug and play panels. So I hope that this was helpful, and I look forward to seeing you guys in the next video.